So I know you've been experiencing some neck pain. You've gone from therapist to therapist to try and figure it out, and it has not gotten any better. So we are going to do just looking at your neck mobility, and we're going to do some exercises too. But I wanted to give you one snippet of information that I don't think other therapists have talked about with you. So there's something called pain neuroscience education. So essentially, sometimes it is not entirely a tissue issue, but in fact our central nervous system, so the way our nerves communicate with our body. So sometimes our central nervous system can become overly sensitized, simply meaning that our body just becomes a little bit more sensitive to things, and because it's more sensitive, it wants to try and protect the stuff around it. So I wanted to just go over an article that I found to kind of show you that it's not just coming from my word of mouth, but there's actually studies out there that show that this pain neuroscience education help to reduce pain as well as that fear of movement. So this article is looking at chronic neck pain. And it is about reducing pain overall and kinesiophobia, which is just fear of movement in patients like yourself with the neck pain. So the key findings from the study showed that the pain neuroscience education, or us kind of talking about your pain and how it works with your central nervous system, the education significantly helped reduce overall pain as well as fear of movement, meaning people became less afraid to move, and people's pain also decreased even though they've had this pain for so long. So evidence quality was rated moderate to high, so it was a good study. And the pain neuroscience education was shown to be clinically beneficial to traditional care. So kind of like we talked about, you've been to those other therapists before. They've constantly worked on maybe tissues or mobilizing your neck, but they were missing that other piece of the puzzle regarding this education piece. Because what happens sometimes is because we have pain all the time, our brain likes to associate, like, I'm going to have pain with this movement, I'm going to have pain with this, I'm never going to get out of this pain. So if we can break that down and allow you to understand that not all movement is bad and we don't necessarily need to fear stuff that's going to increase our pain, then that can help. So that's kind of what the conclusion of this study was. So it is an effective intervention for managing chronic neck pain. So just like you do your exercises, this is another good way to kind of help manage that pain and reduce it. It helps reduce both the perception of pain and the fear of movement. Integration of this into a routine has been shown to improve patient outcomes, meaning you'll just simply have less pain. You'll be able to move around in life without kind of having that fear of, am I going to hurt something again? And then future studies should examine the long-term benefits and optimal combination of this with other therapies. Because like I said, this is another piece of the puzzle. So you have your exercises, you're working on your mobility, but we also have to look at the brain and kind of how it communicates with the body and kind of help it to not be as sensitive so it can allow your body to relax.